first cases of COVID-19 coronavirus infection were registered in Kazakhstan on March 13, 2020. The first person infected in Kazakhstan was the judge of the city of Nur-Sultan, Tlektes Barbipayev, who visited his loved ones in Germany. To prevent the spread of the disease, a state of emergency was introduced in the country from March 16 to May 11, 2020. Restrictions on entry and exit from the country were imposed. Quarantine or other restrictive measures were introduced in all regions. The activities of large non-food retail facilities, cinemas, and other places with a mass crowd of people were suspended. On July 5, 2020, a strict isolation regime began operating in Kazakhstan. All facilities were closed, except grocery stores, pharmacies, cafes, while maintaining social distance, airports, domestic. On March 15, President of Kazakhstan Kassym-Jomart Tokayev signed a decree on the introduction of a state of emergency in the republic for the period from 8 o'clock on March 16, 2020 to 7 o'clock on April 15, 2020. On April 14, by the decree of the President of Kazakhstan, the state of emergency was extended until 7 o'clock on May 1st. On April 27, the state of emergency was extended until 20 o'clock on May 11. Since March 22, the entrances and exits from Almaty and Nur-Sultan have been completely blocked, including for air and rail traffic. January 4, 2020. World Health Organization posted a message on Twitter that a cluster of pneumonia cases has been identified in Wuhan, Hubei Province, People's Republic of China, and investigations are underway to establish the causative agent of the disease. No deaths were recorded. On January 9, 2020, World Health Organization reports that, according to the conclusions of the Chinese authorities, the outbreak is caused by a new coronavirus. World Health Organization is organizing the first of many teleconferences with global networks of experts. It is conducted with participants of the clinical network.
Emotions rise high, and this is understandable and at all such situation when people are locked in their homes and at the same time contrary experiences various fear and crisis. As this refers was their economic situation and health. Many people simply do not know how to what they will have on. This will pass through reason and they cannot afford it in many ways is going on. Kazakhstanis who lost loved ones during the pandemic blamed the government of failing for private to the coronavirus outbreaks and speak to the corruptness that has clipped the healthcare system. Hundreds of millions of dollars were allocated to the health system to fix the coronavirus, but it was applauded for the pandemic and the authorities are trying to make up for lost time. There are acquiring hospital beds, tourism methods, doctors, and medical students. But all this cannot connect those who have lost loved ones. In the fall of 2020, 49 of respondents noted extradited activity, 38 expired traces to strays, and the tribe of respondents found more warning. More than 17% of respondents have changed plans for the future. 68% of respondents stated that pandemic has influenced their activity to life. However, at the same time, 2 of respondents said that the pandemic failed to understand their mental health. The state of allergy has already hit the pocket of Kazakhstanis. In developed authorities are losing money, they have the hardest time because it helps to the business. But how all this will reflect of user working class? It is worth noting that the majority of Kazakhstani people working in private firms with no market losses. It was only who work for the state, by the taxes of your nation's leaders they give their one-day salary help to state, which this provided help to the common people, but here it was vice versa. On top of that, shares its capabilities of the nation currency, because of which is right clear to everyone that will happen next. As the monitoring showing the mood of Kazakhstanis throughout the year was tracked by houses and crises browsing. In the end, this magnificent useful in awareness of vaccines. Only 58% of respondents were ready to vaccinate, even the far rates of safety and effectiveness of vaccines. For example, in June 2020, 65% of respondents were contacted that their station would return to normal by the end of the year. These are work now did not happen as the forwarded because much more pessimistic.
Let's talk about the advantages which we get during a pandemic and emergency. The pharmaceutical industry, the field of medicine and digital technologies have received good development. The coronavirus pandemic gave rise to the development of the textile industry, mass tailoring of masks made of gauze, cotton fabrics and knitwear. And also, according to economist Nurbek Achilov, the closure of borders gives the development of domestic production. And thanks to the pandemic, the digital literacy of the population has increased because many people use online services. During the pandemic, vacancies in the working staff in the store, couriers, seamstresses increased as there was a mass departure on vacation and dismissal. The pandemic gave people the opportunity to develop as a person because people began to spend time with reading books, studying cultures of countries, languages, and develop their new skills. Also, thanks to the quarantine, we get more clean. Our air which we breathe gets more clean. For example, there was a big smoke in Almaty, but now there is none. And the words which say Tokayev is there are two sides to any crisis. On the one hand, of course, it poses a serious threat, but on another, it opens up new opportunities. The goal that we face is to make the most of the opportunities that open up in order to safely get out of the crisis and become stronger.
President of the Republic of Kazakhstan Kassym-Jomart Tokayev instructed the government to take decisive organizational measures to prevent the spread of coronavirus from China to Kazakhstan. First of all, control was strengthened at airports and border checkpoints. The Ministry of Health of the Republic of Kazakhstan began to conduct training exercises with the participation of representatives of the border and customs services, personnel of air and railway passenger transport in order to identify patients and place them in infectious disease hospitals. This body also recommended Kazakhstanis to refrain unless absolutely necessary from traveling to China. Unprecedented in the history of sovereign Kazakhstan with the decision of the head of state on the introduction from March 16 of this year, a state of emergency throughout the republic which was in effect until May 11, 2020. This measure, which met with an ambitious reaction among the population, seems to be quite reasonable given the growth in the prevalence of this disease in the country. The media believes that the pandemic has demonstrated the fragility of globalization and the complete absence of international management of global crises. The black critical assessment of the situation broke the existing system of relationships, the way of life, and it would seem bring only bad things into life. However, acute crises force us to pay attention to the imbalance in our life, to see the shortcomings of the management system, and can help to avoid fatal disasters in the future.
The people did not meet the epidemic without problems. To minimize the risk of infection of the population, the state of different countries, including Kazakhstan, has introduced quarantine measures. Many people are uncomfortable spending most of their time at home, which is why people started ridiculing this problem, for example like this. Many workers and students of schools and universities had to switch to the online mode of work. This aspect of life was also ridiculous. Also, many people started buying toilet paper during quarantine. The reason that toilet paper was bought up so quickly is because that toilet paper costs much less than disposable hand wipes. Not so long ago, various vaccines against this virus appeared in the world. In Kazakhstan it is Kazvak, in Russia it is Sputnik, and in America it is Pfizer. Activists from different countries tried to improve the epidemic situation in different ways. For example, in Rio de Janeiro, a vaccination point was opened in the National Museum of Brazil, and in Austria, in the city of Vienna, a vaccination point was opened in a brothel, the owner of which himself insisted on this decision.